All right. So tonight we're going to go over an overview of what the prostate is, what BPH is, and some other conditions that can affect the prostate, and then treatments specific to BPH. The prostate's a walnut-sized organ that sits between your bladder and your urethra. It produces the fluid that is expressed during ejaculation. It's important for fertility and sexual reproduction, and it grows about to its normal size by your early 20s. After that, it halts for a while, and then in your 40s, it starts growing again, even though it's not helping you. And a variety of conditions can affect the prostate. You can have enlargement or benign prostatic hyperplasia, which we'll talk about tonight. You can have inflammation, either due to an infection or another inflammatory cause that causes pain and discomfort in your prostate, and we call this prostatitis. And finally, the most worrisome thing, you can have prostate cancer. So just a quick overview of BPH. It stands for benign prostatic hyperplasia. Benign means it's non-cancerous. Hyperplasia just means it's more cells than there normally are. So a normal prostate is about 1.5 inches in diameter. Another way of expressing this is about 25 cc's. When it enlarges to about 40 cc's, people start having some urinary symptoms, and the enlargement causes bladder outlet obstruction that leads to the lower urinary tract symptoms. It's important to note that BPH does not mean you have prostate cancer, does not mean that you're at increased risk of prostate cancer. However, that being said, you can have both BPH and prostate cancer at the same time. So it's important to have a very thorough evaluation that involves checking your PSA. If the PSA is high, sometimes you get an ultrasound or an MRI to further distinguish between BPH and prostate cancer. As the prostate enlarges, it can squeeze the urethra and compress it, making it difficult for urine to get out. You see here the picture in the middle shows a normal prostate. Urine can get out easily through the prostate into the urethra. And then when you have obstruction, this impinges in the bladder neck, makes it very difficult for the urine to get out. The bladder wall gets thicker, and that's what causes low urinary tract symptoms. Unfortunately, it's not so simple as saying if you have a big prostate, you have symptoms. I've seen patients with a 120-gram prostate who have no troubles urinating, patients with a 25-gram prostate who are in urinary retention. So there are other factors involved, and it's not just the size, but the shape and the anatomy of the prostate as well. Some of the symptoms you need to look out for are frequent urination, urgent urination, when you can't hold your urine, you have to run to the bathroom, and waking up at night. Those are symptoms that the bladder function has been impacted by prostatic obstruction. Kind of more classic symptoms of the weak flow, starting and stopping of the stream, or not being able to urinate. Those are directly from the obstruction of the prostate. It's important to know that the BPH can affect your quality of life. Up to 95% of men with moderate symptoms are unhappy, and they don't want to continue urinating that way. 49% of men experience sexual problems with low urinary tract symptoms, and 51% of men say it interferes with an aspect of their normal life. You can't really get a good quality of sleep if you're waking up 3 to 4 times a night. BPH does affect your life, and it affects your partner's life and your relationships. If you're waking up, chances are you're shaking the bed and waking them up too. And it also impacts the things that you like to do with your friends and family. Any man can get BPH, but it typically doesn't affect most men until they get above 50. We said it starts regrowing at 40 again. By the time you're 50, you start feeling that a little bit more. As you get older, it affects more and more men. By the time you're above 80, almost every man will have some symptoms of BPH. In 2010, 14 million men in the US had lower urinary tract symptoms. And then certain things increase your risk of BPH and lower urinary tract symptoms. Obesity, having a higher BMI, not being as active or exercising as much. We diagnose BPH by a careful history and physical exam. This involves feeling the prostate, and occasionally it can involve some non-invasive studies such as a uroflow, where we measure how fast you can urinate, and then a bladder scan, or post-void residual, where we see how well your bladder empties and how much is left over after you urinate. There are a variety of questions, scores, and indexes that we can use to help rate your symptoms into mild, moderate, or severe. And of course, there are a variety of treatment options. And the thing I like best about BPH is I tell people, our goal is to make you happy. And so we don't have to do anything that you don't want to do. If you're happy just knowing what causes your symptoms, which many men are, then behavioral modification, adjusting what you eat and how you drink, can help get you to a point where you're happy with your symptoms. Some men do Kegel exercises and bladder retraining to help with this. Then there are medical interventions, either medications or office-based procedures, such as Rezum water vapor therapy or permanent implants to hold the prostate open. Finally, there are surgical procedures. The GreenLight laser therapy, the old-fashioned transurethral resection of the prostate, and a simple prostatectomy are on the more invasive side of things, but still have a valid role in cases of severe obstruction or patients who are refractory to first-line therapies. It's important to note that there is no supplement or vitamin or natural agent that can help with BPH. Even saw palmetto, the most popular supplement that men are on, has no data showing that it's any better than a placebo. Well, let's talk a little bit about watchful waiting. You're diagnosed with BPH, you know that's what's causing your symptoms, but you don't really want to do anything about it yet. That's a perfectly reasonable option. We can adjust the amount of fluids you drink. So decreasing your fluid intake before going to bed will help with waking up at night. Restricting your fluid intake and avoiding bladder irritants can help with frequency, urgency during the day. Unfortunately, it's not going to help with a weak stream and dribbling and starting and stopping. One of the potential issues with this is your symptoms can get worse. However, the good thing is if they do get worse, we can always do something about it, unless you wait too long and your prostate continues to grow to the point where first-line therapies aren't an option. It's important to know that only 19% of men were satisfied with just lifestyle treatment alone as an option. Alpha blockers are probably the most common medication. The most famous one is Flomax or tamsulosin. I'm sure a lot of people have heard about this. It relaxes the muscles in the bladder neck and the prostate and allows urine to flow more freely. It works well, but it's tough taking a medication every day. 71% of men stop taking this medication within a year, and that's because it's tough taking medication. There are side effects. You have nasal congestion, facial fullness, your blood pressure can drop, you can feel dizzy or faint, and it can interact with other medications. Now, feeling dizzy or faint and falling, that can be a very, very serious consequence if you're older. And so there are certain populations that if you have any sort of dizziness or what we call orthostatic hypotension, where you have a little dizziness when you stand up, I am very hesitant to put those patients on these medications because it can be dangerous. 5-alpha reductase inhibitors inhibit the growth and help shrink the prostate by working on a hormonal level. They stop the conversion of testosterone to dihydrotestosterone, and this shrinks the prostate over time. They do have some pretty bad side effects sometimes, not all the time, but it can cause erectile dysfunction, decreased libido, ejaculatory dysfunction, And in some cases, it can even cause permanent breast enlargement. Again, 71% of men stop taking this medication within a year. The issues with these first-line therapies of these medications and their side effect has led us to develop new office-based therapies. The one I'd like to talk to you about tonight is Rezum water vapor therapy. This is an outpatient therapy that uses energy to heat water into the form of steam. It's then injected into the prostate and it condenses on the cells, causing apoptosis by transferring that heat energy. What this does is it kills the prostate cells directly around the urethra, shrinking them and relieving the obstruction on the prostatic urethra, allowing patients to urinate better. Some of the side effects can include painful urination, blood in the urine. These typically resolve over a 3 to 6 week period after the procedure. You can have a urinary tract infection and have worsening urgency before it gets better. One important note is that this does have the potential for retrograde ejaculation and ejaculation or decreased ejaculatory volume, meaning less fluid or semen comes out when you're having sex. That being said, this happens in maybe 5 to 7% of people. And it's very, very rare compared to more invasive surgeries like a laser surgery or a TURP, where it's common in 90% plus. The important thing is it does not have to be done under general anesthesia. There's no permanent implant, and it has a very low retreatment rate, only 4.4% over 5 years. We're going to watch a little video about how water vapor therapy works.
Rezum water vapor therapy is a non-surgical treatment for BPH. Rezum uses the natural energy found in steam to shrink the prostate. In just seconds, this precise technology destroys enlarged prostate tissue while minimizing any effect on surrounding tissue. Rezum is a potential alternative to drug therapy, permanent implants, and surgery. It preserves sexual and urinary functions, and it's clinically proven to safely and effectively reduce BPH symptoms. Potential side effects include painful urination, blood in the urine or semen, pelvic pain, and urinary frequency, retention, or urgency. The procedure is performed right in your doctor's office or outpatient center. You do not need general anesthesia for the procedure, and Rezum therapy lets you quickly return to normal activities. Talk to your doctor about Rezum if you're no longer comfortable with your BPH symptoms. Drug therapy isn't working for you. The side effects from drugs are impacting your quality of life, or you don't want to have surgery or get an implant.
It's important to note that Rezum water vapor therapy has a 97% satisfaction rating. Patients are very likely to recommend it to their friends and family. We'd like to play a patient testimonial for you.
I found out that I had BPH. My symptoms were a slow stream, and I would wake up frequently in the middle of the night. I first heard of Rezum when I was researching enlarged prostate and the procedures to repair it, to fix it. And Rezum was one of them. The more I researched Rezum, it was the latest and greatest technology, and I want to be part of new technology. I think technology is good. My experience with the Rezum procedure was very good. After the procedure, I was a little worn, a little tired, and the next day I felt fairly good and was able to get up and get around.
Since Joe's Rezum procedure, we're able to spend much more quality time together, fewer interruptions, and we're just happier as a couple. The Rezum treatment has made a very big difference in our life.
Another office-based therapy you might hear about is the prostatic urethral lift. This is an outpatient procedure that puts in permanent implants to hold open the prostate. I liken it to kind of pulling open a curtain, if you can think of the little strings you use to tie up the curtain. This creates a channel in the anterior prostatic urethra, allowing urine to flow more easily through it. It has a lot of the similar side effects to Rezum: painful urination, frequent urination, blood in the urine. One of the unique side effects is pelvic pain. Sometimes the tabs can get stuck in the muscle and cause some pelvic pain that takes time to resolve or requires physical therapy to help with. Like Rezum, you do not need general anesthesia. Unlike Rezum, it involves a permanent implant. The retreatment rate is a little bit higher at 13.6% over 5 years compared to 4% with Rezum. But it's also an office-based option that allows you to go back to regular activities pretty quickly. Now I'd like to move on to surgical options. GreenLight laser therapy utilizes a specific laser with a wavelength designed to coagulate blood. So this allows you to destroy the internal prostatic tissue that's causing the obstruction with minimal bleeding, and allows patients to go home as an outpatient. Unfortunately, it does require you to be under general anesthesia and be asleep for this. And so it's typically done in an outpatient surgery center or at a hospital. Some of the side effects include painful, frequent urination, a little bit more severe than with the office-based procedures, bleeding, erectile dysfunction, urinary incontinence, and scars in the urethra and bladder neck that cause a slowing of urination. Now, unlike Rezum, this will cause a retrograde ejaculation or anejaculation in the majority of patients. Whereas with Rezum, it may be 5% of patients who have this issue. With GreenLight therapy, it can be over 90%. That being said, it's an excellent option for patients who aren't a candidate for Rezum due to the severity of their obstruction or the size of their prostate. It's a tried and true method with an excellent outcome, has a minimal retreatment rate of 4.8% over 5 years. I'd like to show you a video about GreenLight laser therapy. This just shows the laser fiber that we use. It allows us to shoot the laser at an angle to our camera and target the prostatic tissue while sparing the bladder. Those little bubbles you see are carbon dioxide. It immediately turns the tissue into gas. That's why it's called vaporization. And as you can see, it creates quite a large channel in an otherwise very obstructed prostate, allowing patients to urinate much better. It's important to note why there are greater side effects and potential consequences of this GreenLight laser therapy. There's also a more improved symptom reduction compared to office-based procedures or medications. Transurethral resection of the prostate is kind of the old-fashioned way of doing the laser therapy. It creates a channel by using cautery and resection, either a monopolar or bipolar resection. The side effects are the same as the laser surgery. Both have to be done under general anesthesia, and the retreatment rate is similar. The downside of transurethral resection of the prostate is that it typically causes more bleeding than the GreenLight therapy. And as a result, patients typically have to spend a night in the hospital. Unlike with the GreenLight therapy, you can go home the same day. Simple prostatectomy is probably the oldest version of these surgeries. It's now reserved for very large prostates, greater than 100 grams. A normal large prostate where we would do an office-based treatment is probably between 40 and 80 grams. GreenLight can treat 80 to 100, but much larger than 100, and you need something called a simple prostatectomy. We now do it robotically, which reduces the bleeding risks, but it still involves an overnight stay in the hospital. That being said, there are slightly higher risks since it's an intra-abdominal surgery, but the benefits are tremendous. Patients urinate very, very well after these surgeries, and there's a very low retreatment rate. It's important to note that with insurance coverage, there's not one specific plan that will approve of any one given thing. Every patient has to check with their insurance whether or not their particular plan will cover the treatment of choice that they're interested in. So in summary, your options for BPH are watchful waiting, taking medications or office-based therapies such as Rezum water vapor therapy, or surgical procedures such as the GreenLight laser ablation of the prostate. All of these things can help you with benign prostatic hyperplasia and the impingement of the prostate on your urethra and your bladder neck, and can help you regain control of your life. It's important to consult with a urologist to discuss which option is best for you. Not every option will work for every patient. Each prostate is different than the other, and it's important to find a urologist who will deal with all of the treatment options. I personally perform the prostatic urethral lift, the water Rezum, the GreenLight laser ablation, and the robotic simple prostatectomy. And so I feel like that offers the patients all the different options and covers the gamut of therapies. But it's important to talk to your urologist. If you like, you can call the number on the screen to see me at my Jollyville or Westlake locations.